Great. All right. Thanks, everyone. Hi, I'm Annika Izagiri. I'm Communications Director with the Committee to Protect Healthcare. Thank you all for joining us today. It's a lot easier virtually than driving through the snow and sleet that's taking place everywhere. So appreciate you having you here, though. We are joined today by physicians across Michigan, one of whom is also a state representative and bill sponsor, to talk about the need for legislation to expand immunization information and protect vaccine access for families in Michigan. Over 260 physicians across the state have signed a letter in support of this legislation, which was enrolled yesterday. And the bill numbers, for those who are curious, are House Bills 5344 through 5354. I'll type that in the chat as well. Before we begin, I'd like to note that the physicians speaking today are doing so as individuals and with the Committee to Protect Healthcare, not necessarily on behalf of any employers. So we respectfully ask that you please refer to them in any coverage as they introduce themselves, and please do not include employment information unless they expressly share that. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, State Representative Dr. Matt Longjohn.
Thank you, Annika. And thanks everyone for taking time out of your busy day to jump on this call. I know physicians across the state are here on the line with us today, and this is timely and important, so I'm grateful to have everyone's attention. As I was introduced, I'm State Representative Matt Longjohn. I represent the 40th House District in Michigan's Kalamazoo County. I'm privileged enough to represent the city of Portage, Oshtemo and Texas Township, and two precincts in the city of Kalamazoo. I'm also the only medical doctor in the entire Michigan legislature, House or Senate, and thrilled to talk to you today about a package of bills that was enrolled yesterday, and which you may have seen press conference and press coverage on last week. I'll just share a few comments about what this package is and what it does, and a little bit more contextual information. But again, thank you all for joining us today. We are here today, though we can look at vaccine hesitancy in a lot of different contexts, timeframes, certainly COVID to now or historically, but we are here today because RFK Jr.'s handpicked groups of vaccine science deniers met last week. And they debated a lot of sweeping changes to the entire childhood and adolescent vaccination schedule. And they ultimately voted to delay one of the vaccines that was identified under the decades of work under the American Committee on Immunization Practices, evidence-based protocols as an important vaccine for infants to receive. That was the Hep B infant dose. They've now delayed. This is a significant issue, as many fellow clinicians know. About 90% of Hep B infections were reduced after the infant dose was added to the schedule in the past protocols of the ACIP or ACIP or that American Committee on Immunization Practices. Those are all the same thing, just different kinds of ways to refer to it. But these reckless actions that RFK's team of anti-science folks at the CDC are taking require state-level policy actions in response. And I'm thrilled to be a part of a package to work with a number of representatives in the State House to introduce the Empowering Parents and Protecting Communities package of immunizations. For decades, the CDC's ACIP, or American Committee on Immunization Practices, has had an impeccable record and reputation for following the world's best available scientific evidence related to not just vaccine science and molecular biology and things like that, but the practice-based evidence of what it takes to increase vaccination rates, provide herd immunity for our most vulnerable, and all of that science is taken into account, has been in a routine way by the ACIP for many, many years. But as you know, after RFK Jr. came into his role as U.S. Health and Human Services Secretary, he hijacked that committee, ousted the legitimate experts, and put into place his allies who are bringing an agenda to what should be an evidence-based process. That's not okay. So, the ACIP is so pervasive in the way and so respected that many other aspects of our society hinge on its annual meetings, its routines, its protocols. Drug manufacturers, vaccine manufacturers, they determine their manufacturing orders, their inventories based on recommendations from the ACIP. Schools depend on the ACIP's recommendation to know that kids can enter school safely. Insurers, obviously, my fellow physicians and practitioners, so many aspects, pharmacies, pharmacists, so many parts of our society and public health depend on the ACIP that it is tragic and a huge problem that ACIP is being politicized. At this point in time, Medicare and Medicaid are another example I can't pass over. They automatically cover through the Vaccines for Children program or et cetera, any of the immunizations that are covered by and recommended by the ACIP's schedule. The chaos, confusion, and distrust that is being engineered by RFK and the folks at the CDC who are fitting data around their conclusions are causing vaccine skepticism to rise, vaccination rates to fall, risks of infection, illness, and death to increase. And this is happening now. The U.S. is expected to lose its status over 25 years old now as being one of the countries that's contained measles. We are now expected in January to go back to a place where the U.S. is considered to have measles to be endemic. We have over 1,800 cases in the country this year. And because of diminished herd immunity in places where measles outbreaks are occurring, we are having a harder and harder time getting our arms around these outbreaks, not just in clinics, but in public health practice. And this is deeply concerning, I know, to so many of us on this call. In this challenging time, the most important thing that we must all do is stay on message and encourage patients and parents to get back into their healthcare providers' offices if they have questions, to make sure that they are availing themselves of their healthcare providers or obtaining primary care advice so that they can make the best decisions available for themselves and their family members. But I know that those of you on this call who've signed this letter, the 263 plus docs who have signed on to this, understand that vaccines save lives and that any respectable medical professional will not just tell you that vaccines save lives, but that there is no clear, reproducible, or significant evidence to say that vaccines contribute to autism and other aspects of ACIP and RFK's agenda. So in Michigan, we've responded by putting together this 11 bill package, the Empower Parents and Protect Communities package. I've been thrilled to work with Representative Phil Skaggs in the Grand Rapids area to work on this for months. We were working on this, and then the week before Thanksgiving, we all saw notice that RFK Jr.'s committee was going to meet last week. So we sped this up and got the bills introduced yesterday, but we had a press conference on it last Thursday. The bills have really four main goals in this whole package. The first is to make sure that parents are informed, no matter what decisions they are making. And that's not just about what decisions they make for vaccines. But we have now schools with vaccination rates at the building level down into the 30s and 40%. So, if you are sending your kid to childcare or to a school and you don't know what the vaccination rate is in that school or that childcare center, and maybe like me, you have a cancer survivor in your household or an older adult who's immunocompromised in your family, you might need to make a different decision about where to send your kid to school. So we want to inform parents by making sure that building level vaccination rates in all schools in the state and all child care centers in the state are publicly displayed, that they are communicated by the people that parents trust, that they've chosen to put their kids into care with, the teachers, the child care centers, to convey to them what they know about the vaccine rates in their communities, in their buildings. It's not enough for the state health department to just have these building level data on a website or in a spreadsheet someplace. We have to activate this information. We have to get it into parents' hands so that they can make the most important and informed decisions that they can. In addition to informing parents by giving them the information they need at building level for schools and childcare, a major thrust of this package is simply codifying policy that's been in place since the Snyder administration in administrative manuals on how the Michigan Care Improvement Registry, or what was previously known as the Michigan Childhood Immunization Registry, or MICR, has been doing for decades. It's not been controversial. It's been bipartisan. But now that we're seeing these attacks and RFK's actions, we believe we need to codify much of what's been going on in practices and in clinics and in schools for over a decade into state law. So that's another part of this package, a thrust of this package. There are no new mandates here. In fact, in part of the package, we are codifying policy that's been in place for non-medical waivers. If parents choose to, for medical or non-medical reasons, not vaccinate their kids, they should also trust that their wishes are going to be followed. So following the codified policies that have been in place to make sure that people who choose not to vaccinate know that their wishes are going to be respected in schools and child care is also part of this package. The third part of the third thrust or major goal of this package is to reinforce state level credibility in public health. We can't, as Senator Bill Cassidy, Republican senator from Louisiana, said this week, the ACIP has lost all credibility. And so we need to find ways to build trust again in public health. And that means, in this case, separating the health department's guidance from what might have just been triggered in the past by ACIP's guidance. So giving the department new authorities, giving the state's chief medical executive the authority to issue orders, not just recommendations, that pharmacists can follow and that insurers can make sure payments follow from those orders. Those are all part of this package. Last but not least, we want to make sure, of course, that vaccines remain accessible and affordable, and that's where that insurance coverage piece fits in. So, in short, or shorter, the Empower Parents and Protecting Communities package makes information about immunization reporting easier to organize and access at the state health department, and to get it into the hands of parents in time to make important decisions. We respect individual privacy and choice with this package, and we give families, pharmacists, doctors, insurers, schools, and health departments new tools that they need to make sure that Michiganders can live their healthiest possible lives. So with that, I'd like to introduce Dr. Jenny to speak.
Hi, thank you so much, Rep. Longjohn. That was really great. My name is Dr. Heidi Jenny. I am a board certified emergency medicine physician. I have been practicing in the Metro Detroit area for the past 19 years. I champion sepsis at my hospital, and I'm the emergency medicine trauma director. As a physician, I've spent my career helping patients protect their health care, and with that, helping them protect their family's health care. Today, I'm calling on the Michigan lawmakers to do the same. I'm joined by doctors across Michigan who are calling for the passage of the Empower Parents Protect Communities bill package. A number of House Democrats enrolled this legislation just yesterday, including Rep. Longjohn. Over 260 physicians across the state have signed this letters in support of these bills, House Bills 5344 through 5354. We've signed in support of these bills because they would ensure that parents have better access to the immunization rates for schools and child care centers in their communities so they can make informed decisions about where to send their children. Because they would require insurance companies in Michigan to cover vaccines. And because they'd authorize the state to set our own vaccine recommendations based on the recommendations of trusted physician-led organizations. These bills couldn't come at a more critical time. As Dr. Longjohn mentioned, last week, U.S. Health Secretary Robert F. Kennedy Jr.'s federal vaccine advisors took a step to upend the childhood vaccine schedule. The Advisory Committee on Immunization Practices, the ACIP, voted to end the recommendation of vaccinating all newborns for hepatitis B. Hepatitis B is a highly contagious disease that causes severe liver damage. It has no cure. It is managed with antivirals to help slow the liver damage, but ultimately can lead to chronic illnesses, and that leads to liver failure. It can lead to liver cancer, cirrhosis, and all of that is a chronic illness that someone lives with the rest of their life, and ultimately some people die. Babies and young children are at the highest risk for developing the chronic infection. Giving newborns the hepatitis B vaccine keeps them safe from this sort of suffering. The hepatitis B vaccination is key to preventing the infection in the first place. Without vaccinations, as many as 9 in 10 infants infected with Hep B in their first year of life will develop this chronic illness, which does eventually lead to liver failure and for some death. Since the universal vaccine began in 1991, childhood hepatitis infection rates have dropped by 95%. And the medical community overwhelmingly agrees we should continue this practice. But politicians like RFK think they know better for our patients. They think they know better for our parents. Michigan parents deserve the freedom to protect their children from preventable diseases like Hep B. That's why these bills are so critical and why all Michigan lawmakers should support them. Politicians who don't support parents' freedom to keep their children safe should be held accountable. As a doctor in Taylor, a community represented by Representative Riley Linting, I'm deeply disappointed that she did not sign in support of these bills to protect vaccine options for families. I hope that Rep. Linton will reconsider and work to get these bills passed. Parents are counting on Rep. Linton to do better for their families, for our communities, and for everybody to stay safe. Now, I would like to introduce Dr. Alan Wilkie.
Thank you, Dr. Jenny, and thank you, Dr. Longjohn. My name is Alan Wilkie. I'm a board-certified family physician with a geriatric subspecialty. I'm the former chair of family and community medicine at the Western Michigan University Homer Stryker MD School of Medicine. Although I'm now semi-retired, I do remain clinically active. As a physician, my starting point is first, do no harm. I only wish that Secretary Kennedy and his minions would do the same. My representative, House Speaker Matt Hall, also chose not to co-sponsor or publicly support these critical bills, and in doing so, tacitly supports RFK Jr.'s big lie about childhood vaccines. When Kennedy repeats the big lie, he sows doubt about their safety among parents who want only to do the best for their children. This hesitancy has resulted in our current measles epidemic, which has killed children. Can you imagine the grief parents feel when their children die of a preventable infection? While RFK and his cronies are taking unprecedented steps to take away vaccine access, Michigan families deserve leaders who will fight for their freedoms, not just roll over. Unfortunately, Speaker Matt Hall just seems to be rolling over for RFK. As a physician and constituent, I urge Speaker Hall to rethink his position on these bills and help support them moving forward. The ACIP didn't just scrap the long-standing hepatitis B vaccine recommendations. They're also planning to examine whether vaccines on the childhood schedule cause allergies and autoimmune disorders, even though that the research overwhelmingly shows they do not. These actions don't just undermine public trust in the vaccines, they also jeopardize access, opening the door for insurance companies and government programs to no longer cover vaccines for families. Michigan families should be able to work with their doctor, nurse, or pharmacist to get the vaccines that health experts recommend for them, free of cost. And vaccine recommendations should come from experts in healthcare and research who understand both vaccine benefits and risks, not politicians like RFK Jr., who's working his own agenda. As doctors, we don't trust RFK Jr. to make the best decisions for Americans' public health, and the American people don't either. RFK Jr. has single-handedly destroyed the CDC's reputation. That reputation took years to establish. Maybe many years after RFK exits this stage and the CDC's reputation can be restored. But until then, we must rely on our own doctors and infectious disease experts. That's why it's imperative for the state of Michigan to be able to set our own guidelines for vaccinations so that parents have the freedom and ability to protect their children with immunizations, so that parents can feel secure in knowing that they are, if they choose, following the advice of medical experts, not politicians like RFK. So they can know that vaccination rates at schools and child care centers where they entrust their children. Some people may still choose to exempt their children from vaccines. That's okay. Some people may not care what immunization rates their children's schools are. That's okay too. But for those who do care and those who choose to follow the medical recommendations, these bills will protect their freedom. The Empower Parents, Protect Communities package will ensure parents in Michigan can continue to make decisions that are best for their families to keep them safe. Speaker Matt Hall should sign on in support of these bills and urge his caucus members to do the same instead of letting RFK bulldoze our protections. Thank you.
Thank you so much, Dr. Wilkie, Dr. Jenny, and Representative Longjohn. We'll now open it up for questions. If you have a question for one or any of the speakers, you can raise your hand, as I see a couple of you have done. You're also welcome to chat your question in the Q&A box or the chat box. But again, raising your hand is fine, so I'll call on people in the order I saw. First, we have Eli Newman with Bridge, Michigan. You should be allowed to talk now, Eli.
Hello, everyone. Can I be heard?
Yes.
Wonderful. Thank you so much for everyone's availability. My question, I guess I'd like to start with Dr. Wilkie and just understanding the reservations that patients have in getting vaccination and why you think that that exists just among patients who might be a little bit more hesitant to get immunized.
If I understand your question, Mr. Nguyen, you're looking for why I think people are hesitant or parents are hesitant to get their children vaccinated?
Correct.
Because of RFK Jr.'s big lie. This nonsense has been going on for too long now. Every time the man opens his mouth, he's saying that vaccines aren't safe. That's a lie. But unfortunately, if you tell the lie frequently enough, people are going to start taking notice, and parents they don't want to harm their kids. So they're going to say, well, maybe I shouldn't have my child vaccinated. But there's no discussion about the risks and benefits of vaccine at that point. There's just casting the seeds of doubt.
But certainly those doubts have existed before this administration, right? Like I've been looking at waiver rates in schools and saw that in 2013 there was a reported high of students not getting vaccinated. So I guess I'm more so wondering just in the kind of the in a bigger scope of just in your practice, like because I assume that these patients have existed throughout the years, and I guess I'm just trying to understand what you think might be the most like what is that the thing that leads them down this path towards hesitancy, aside from what we're also getting from I guess the CDC from the Health and Human Services today.
Sure. And I should have said, Mr. Newman, it goes much further back than just last year or when RFK became secretary. I mean, he's been doing this for 20 years. The the notion that vaccines are not safe goes back decades now, but it's been a fringe issue. And it's only now coming to the fore. The other thing that plays into all this is vaccines are incredibly effective. When's the last time you saw somebody with polio? When's the last time somebody has had another vaccine-related illness? Parents don't see chickenpox any longer because, well, that's because the kids have been immunized. So if you're not seeing illnesses, preventable illnesses, you become complacent. You don't know how bad things can get.
Thank you for that perspective.
Thank you.
Thank you both. Andrew with MERS, you should be allowed to talk now.
Hi, yes, thank you for taking my question. My question's for Matt Longjohn. I'm wondering who you've talked to on the Republican side, how much support you've got right now to actually get any of these bills through a highly divided legislature.
Yeah, thanks for the question, Andrew. First, I want to note that this has been moving very quickly in the last couple weeks, and that for reasons that are somewhat irrelevant, there was an ALEC conference last week in Texas, so the House didn't convene last week, so we only had the opportunity to really talk to members of the House on the Republican side in the last few days. But I have to tell you, I'm deeply disheartened. Myself, multiple members of this package were on the other side of the aisle yesterday, talking to our colleagues about this package, trying to even lift up that there are no choices being taken away from anyone here. This is a common sense approach to these issues where privacy and people's personal choices around vaccination or school choice are completely respected by these bills. So we had hoped that common sense might prevail in some corners of the Republican caucus. But I'm deeply disappointed to say that yesterday, despite multiple conversations by multiple members of this co-sponsorship package, that we were unable to achieve any Republican co-sponsors on any of the 11 bills that I am aware of. Now, keep in mind, one of these bills, for example, literally just has a couple words changed from existing statute to make sure that things that are already being done to produce data that sit on a website could become more useful to parents. And, that's, again, not changing anybody's choices. It's just giving people more information. And without getting into, kind of confidential and personal communications with specific representatives, I'll just say that there are a number of folks in the Republican caucus who have healthcare backgrounds. And I thought for sure that there might be some folks there that would at least entertain the conversation. But that was not the case yesterday. So at this point in time, we have no Republican co-sponsors on any of the 11 bills.
As a follow-up, it seems like there was the Board of Education meeting yesterday. It seems like there's some type of something revving up on the other side as well, framing this as a mandate, and they were blaming the Board of Education for trying to push a mandate. But it seems like this is where it's coming from. How do you respond to the fact that, and you've said several times that this is not a mandate, but to the perception from people that this is a mandate of mandated vaccination?
Yeah. So again, all of us who've been concerned about infectious diseases in schools, whether you're a school administrator who has read history and understands um, just the blanking on a word here. I'm sorry, just the infectiousness of measles, for example. School administrators, childcare administrators do not want measles in their facilities, right? Like they don't. And so the State Board of Education, it wasn't yesterday, it wasn't last week, it was in September that the Board of Education passed a resolution to say that building level vaccination rates need to be available to parents. Um, I believe that that occurred in September in part because of enterprising reporting that was done by MLive and others who found the data on the DHHS website, as they've done in other years, and run a story about vaccination rates in the Grand Rapids schools. So, these are concerns that we've all been able to predict given RFK's stances, his agenda. And so it's not just the Board of Ed or the legislature or the governor who issued an executive directive or Dr. Bagdasarian, the chief medical executive for the state, who issued recommendations back in September. It's 14 other states that have also created these kinds of policies to recognize that we have to have some state level policy action here. To your point about the mandate, there is a little bit of mandate in here. I should be very clear. The one new piece of responsibility for any stakeholder in this process is that school or school district or that child care center that just like a restaurant has a or B rating on the wall, like a public health advisory. There now will be a requirement that information about the building vaccination rate is posted someplace. That is the extent of any mandate placed on any stakeholder in the system of Michigan's immunization and vaccination program.
Thank you, Matt. Appreciate it.
Thanks for those questions, Andrew. Eli, another question?
Yeah, I actually wanted to follow up on that point about the mandate for buildings to publish these, like whether it be like signage. Well, I guess for one, I guess I'm wondering, d does the legislation specify how this is going to be published? And for two, I'm wondering if the health department has the ability to compel that kind of publishing with like an administrative rule change or a policy change without a legislative codification.
Yeah, great. Thanks again for the question. So I guess I'll take the second one first. The 11 bills deal with different sections of law. There's public health code, there's school code here. Um, Depending on the bill, the authority that follows from statute flows down into state and local government. So, for example, the building level reporting requirement would be on districts to enforce at the building level. Um, but depending on the bill, there's different source of authority and how that would flow. And I'm sorry, Eli, I'm forgetting your first question.
Yeah, I was wondering if the legislation specified how
Yes,
the reporting would
great.
be published.
Yeah, so it does have one specific example where it says, this information shall be posted in one of the bills. It's for schools. It says this information shall be posted in a publicly visible space in the main office of a building. But in other places of the legislative package, there's flexibility here. So even meeting with school groups before we introduced this, we understood that there might be even better solutions here. We felt like we were in a rush to introduce these things because of the actions being taken at the federal level. But we are anxious to work with schools and health providers and administrators of school districts, et cetera, to make all of these things work best for all the stakeholders. So, for example, schools pointed out to us that they have a school data report card that typically is published, I believe, in February, and that it might make most sense to try and get some of these data into that report card system so that it just kind of happens automatically every year. But they also appreciated that we were giving them flexibility with this package to do what they do best, and that's communicate with the parents who have chosen to put their kids in these other folks' care. So, whether it's a handout at the back to school, kind of return to school event in August or September, or whether it's a newsletter that goes out to parents at the end of the school year to say, before you make decisions about sending your kids back to the school, maybe you want to know the vaccination rate. Schools have all kinds of opportunities there to post things on websites, to post things not just on that office wall, but to make sure that they do what they can to get good information into parents' hands.
Thank you both. We'll allow another minute in case there are any follow-up questions. In the meantime, too, I will offer that we have been recording this. So if you'd like a copy of the recording, please, you can send me a chat right now or send me an email where you RSVP'd at annika@committeetoprotect.org, and I will send you over that recording this afternoon. But I am not seeing any other questions, so we'll go ahead and wrap up. Thank you again to all of those from the media who joined today. We appreciate your time and your thoughtful questions. Thank you so much, Representative Dr. Matt Longjohn, Dr. Ellen Wilkie, and Dr. Heidi Jenny for being on today and for advocating for this critical legislation at this very critical time. Thank you.
Thank you.
Thank you.
Have a good afternoon, everyone.